The mouth is one of the most important parts of the body. We use it to communicate, to eat, to drink. And just like your gut, your mouth has its own microbiota where various bacteria grow and live in symbiosis with you. Under certain conditions, harmful bacteria can grow and cause deterioration of the teeth and gums. But this bacteria doesn't just affect your mouth. It can spread to other areas of your body and cause other health effects. Therefore, your oral health is extremely important. According to the CDC, 1 in 4 adults have untreated tooth decay, and 46% of adults 30 years and older show signs of gum disease. Well, at this point in the video, you might be asking yourself, Leanna, why are you doing your psych final on oral health? And to that, I can only say I'm nerdy enough that I listened to a 2-hour podcast on it and thought it was fascinating and try to implement psychology to get people more motivated to take better care of their mouth. I'm apologizing in advance. But in this video, we will look at the brief mechanisms of tooth decay, current protocols for maintaining oral health, and psychological tools to increase motivation in implementing those protocols. So, first things first, what is the anatomy of the tooth? Well, it's composed of 3 layers. The outermost layer is the enamel, underneath that is the dentin layer, and underneath that is the pulp where nerves and blood vessels are stored. Alright, so how do cavities form? They begin to form when harmful bacteria that feed off of carbohydrates and sugars left over in your mouth from your food produce acid that break down the minerals that make up the enamel. But what's cool is that your body has a mechanism to combat cavity formation when it's in the enamel layer, and that is where your saliva comes in. Because your saliva is at a neutral pH, it produces an environment that inhibits those acidic bacteria to grow and provides the tooth with calcium and phosphate minerals so that your enamel can reform. So the following protocols help promote cavity reversal in the enamel layer, and it promotes a healthy mouth microbiome. So the first protocol is brushing your teeth and gums twice a day to remove bacterial buildup on the teeth. And this is especially important at night because you produce less saliva while you're sleeping, which in turn creates an environment that promotes the acidic bacterial growth. The second protocol is flossing to remove food particles that the bacteria can feed on, and the third is making sure to keep your mouth at a neutral pH by rinsing your mouth out with water after eating. But although these tips are all fine and dandy, there is one problem. Majority of people know what they have to do to maintain oral health, but they don't necessarily stick to these protocols 100% all the time. Many skip brushing their teeth every once in a while, or they might be too tired at night to get up and go through their teeth cleaning routine. So that's where the psychology comes in. How do you motivate people to keep up with their teeth cleaning regimen so that tooth decay and gum disease can be decreased? The first solution is to keep track of how consistent you are cleaning your teeth. For instance, how often do you skip cleaning your teeth at night or in the morning? Do you floss regularly? And so on. You can download apps like Brushout to keep track of your teeth cleaning habits and collect various achievements that help with extrinsically motivating you to continue. Reflecting or keeping track of your oral health habits is important in combating cognitive dissonance, which is the phenomenon that occurs when your beliefs about something doesn't align with your actions, so your beliefs or actions change. In this case, I believe that many people think that keeping on top of oral health is important, but sometimes people can skip taking care of their teeth due to laziness, being tired, or being in a rush. And so their perception of the skipping is changed and rationalized so that they feel better about themselves. The second solution is to brush and floss your mouth right after you eat dinner or a snack and before you get into bed. This would be useful in combating ego depletion where self-control and willpower are used up on other tasks. For instance, if you have had a long, exhausting day, you might not have the willpower to get out of bed to brush and floss. Another solution is to choose a friend or friends that are willing to work on being consistent with their oral health habits. Choose a goal like brushing twice a day and flossing once a day for 6 months straight. you can hold each other accountable by sending pictures to one another as proof. If everyone completes the goal, then a reward can be given, like a weekend trip or a night out at a special restaurant. However, if someone in the group fails, then the group has to start over, and a negative punishment can be enforced on the individual who may have skipped a day. This punishment could be taking away phone screen time or something of that nature. The benefit of this solution is that it satisfies two aspects of the self-determination theory, which simplifies the basic psychological needs into three aspects: relatedness, autonomy, and competence. In this solution, the cooperation aspect increases feelings of relatedness between the group members and causes members to be more intrinsically motivated to keep completing the goal. Furthermore, since everyone has to do their part, autonomy is maintained, as it is the individual's choice to decide when they would like to do their part. No one is forcing them to do it. Overall, knowledge only goes so far. It is the application of that knowledge that is important, which is why using psychological principles to apply it is necessary.